We all have our gifts, but sometimes it takes more time and special efforts to bring out those gifts in some of us. Parents who have children with learning disabilities may know what I'm talking about. Many of them have seen how early diagnosis and intervention can help a young student who is struggling and restore confidence in class. Dyslexia is one of the most common learning disabilities. As many as 1 in 5 children struggles with dyslexia, according to Yale's Center for Dyslexia and Creativity. Now, this hour, we are examining dyslexia. What are the signs and symptoms? How are they diagnosed? What are the misconceptions about dyslexia? And what can be done to help? I have 2 guests joining me in the studio today. Dr. Elizabeth Schnobrich is a clinical psychologist who diagnoses children with learning disabilities at Groves Academy in St. Louis Park. It's a learning center for children with learning disabilities and attention disorders. Good to meet you, Elizabeth.
Thank you, Angela. It's great to be here.
Mary Beth Kelly is a former special education teacher who now does assessments for children and adults through a nonprofit called the Learning Disabilities Association of Minnesota in Golden Valley. Hi, Mary Beth.
Hi. Thanks for having me.
Well, I want to begin by getting a better understanding of dyslexia. And Dr. Schnobrich, I'll begin with you. What is it?
So dyslexia has a lot of misconceptions, as you mentioned in your opener. Dyslexia is a language problem. It's not a cognitive problem. There have been a lot of stigmas and shame involved in the past where kids with dyslexia are labeled as slow learners or unintelligent or lazy, and none of those are true. People also think of dyslexia as simply reversing letters, such as B and D, but there's so much more to that. And actually, the most defining characteristic of dyslexia is a difficulty in processing phonological information, which means how they can recognize, manipulate, and learn speech sounds. And that's really the main focus, is that phonological understanding.
So describe to me what a person with dyslexia may be experiencing as he or she is trying to read a page on a book, for example.
So there's a lot of different things that may happen. What happens is they have a hard time breaking down the sounds. So when they see a word, we call it decoding, but that means that they have a hard time sounding out the word. They struggle with understanding what each of those individual speech sounds make and how they form a word together and putting it all together. So they lack that decoding ability. And so what you see, sometimes see is kids with dyslexia, they memorize words and they compensate for their difficulties. And that's one of the reasons why it can go misdiagnosed or undiagnosed, is that they work really hard to hide those difficulties with memorization.
So these could be high achieving students.
Yeah, I was just going to add to that, like another example of it, just a practical example of a child reading. A lot of times they'll rely on pictures. So it might be a picture of a rabbit, but they might say bunny instead of rabbit. So they're not getting any of the phonetic words correctly. They're relying on that picture. And so they're just kind of taking a guess at what that word is.
And so, Mary Beth, in a classroom setting, how does dyslexia show itself? Like, what would make you give a second glance to a student?
Well, honestly, it could be behaviorally. So they have resistance to reading, not wanting to read, not wanting to read out loud, not wanting to read and do longer reading assignments. Also, they might try and come up with all sorts of excuses and try and do something else, or have somebody else do the reading and they just listen. So the other strategy I would say is young kids get really creative. They're very creative. Mm-hmm. So they're really good at trying to figure out, how can I still do this assignment without having to actually read or decode these words? So can I work with a partner, and can that partner maybe do the reading and I'll just answer the questions, because they can do better hearing the information than actually having to read it themselves.
And, you know, in the diagnosis part of this is tricky because, you know, kids really don't start learning how to read until, like, I guess it kind of varies. So at what age would you see the first signs of this?
Well, you can actually see some of the risk factors and signs pretty early on. You know, one of the risk factors is talking later. There's some signs in preschool even where they have difficulties pronouncing certain words or syllables, such as biscotti for spaghetti or aminal for animal.
I've heard all those.
Yeah.
Right?
Yep. And that's and that again is that you know, the ability to put words in a certain order and put it together in the right way. They also have a hard time learning their letters and their letter sounds. And, you know, it's also interesting is it's more than just the reading. You know, they have difficulties with numbers, with days of the week, with learning time. And they also have a difficult time recalling certain words or names. So, for example, they might describe the word. So if they're trying to tell a story and they're trying to think of the word table, they might say, where we eat dinner. And they'll use more descriptive words then, and they have a hard time recalling some of those words. So those are some of the early signs. And then as kids get into our elementary school and early elementary school, we can see some of the different signs in the classroom. But there are actually signs even before they reach that elementary age.
And so once a child gets a diagnosis, what changes in a school setting? So what's different then? Now that we know that it's dyslexia, what happens, or how does a school respond?
I feel like that's a two-part kind of question. First and foremost, schools don't generally diagnose for dyslexia. It's usually outside agency because it's a medical diagnosis. So schools more use an educational criteria. So depending on the severity of how that child maybe is not responding to interventions or not reading at where they need to be, they may qualify for additional services, which we would call special education. But they would use probably the term learning disability in reading instead of that term dyslexia. But the hope would be that the school would respond with some type of small group, intense intervention and direct instruction to try and teach the basic phonics that we already talked about, that there's a missing kind of gap for these children. They need to really go back and learn beginning sounds, end sounds, how we put those sounds together to create a word, to kind of create meaning. But the hope is that they would get that kind of direct instruction, like I said, and typically it's more intensive and works better if it's in a smaller group.
So the diagnosis, it's a medical diagnosis. So Dr. Schnobrich, how do you make this diagnosis? What's the testing like to determine if a child has dyslexia?
So I can only speak to Groves Academy, where we do our assessments, and we see close to 1,000 kids a year as part of the diagnostic assessment at Groves in our Learning Center. And for us, it's a very comprehensive evaluation because we want to look at the whole child. So if a concern is whether or not the child has dyslexia, that's one area that we look at. We look at their overall cognitive ability. We look at how are their achievement scores, how are they scoring compared to other kids their age on areas of math and reading and writing. And then we really break down the phonetics, as Mary Beth was talking about. We really want to understand their phonetic capabilities. How well can they understand letter sounds? How well can they pick out sounds in words? How well can they blend words together? How well can they decode nonsense words? We look really in depth at all of those different areas of reading. But it's also really important to look at the whole picture of a child because with dyslexia, there can be other things going on. We call it comorbid, which means the high likelihood of other diagnoses. There's a high likelihood of other learning disabilities that can go with dyslexia, such as written language or math. There's also high levels of anxiety, ADHD, depression, all of which are going to cause additional issues with the child. And if we don't have the clear picture, it's really hard to create the best plan moving forward so that that child can be successful in their academic career.
And how common is it? I use that stat of as many as 1 in 5 children, and that comes from the Yale Center for Dyslexia and Creativity. So that's, they say dyslexia affects about 20% of the population. That's a lot of people.
So that is a lot of people. And I would even argue that, we don't catch everybody. There's a lot of kids who go undiagnosed. There are a lot of adults who didn't get the diagnosis as children because of the way we view dyslexia in the past and the stigma associated with it. And like we've talked about, the highly achieving and intelligent people have found ways around it and have gravitated towards careers where it's not as much of an issue and maybe they don't read as much. So there's a large population that probably was misdiagnosed or not diagnosed. And that's why it's so important that we take the time to do that. I would say that there could be more, but at least the estimated the figures that I've seen is approximately 20%.
And I just want to take a moment. If you are just joining us, we're talking about dyslexia this hour, the signs, the interventions that are available to help people overcome it. If you have a question or a story to share, give us a call at 651-227-6000. You can also leave me a message on Twitter. I'm at Angela Davis, MPR. I want to read this message on Twitter that Westlake Fiery left. And this person says, I have never been diagnosed. I am 58. No one spoke of dyslexia. They kept trying to get me to speed read because I was smart, and they thought I should be doing better. I dropped out of college, have a professional job still struggling, getting worse. What do you make of that person's story, Maybeth?
Yeah, we were talking about this just a little bit earlier that I don't know why, but one of the more common screenings that schools do is they do time tests to see how well children can read. And part of that I know is that children tend to comprehend better if they're fluent readers. But that doesn't mean that everyone's going to be a fast reader. So you have children that maybe take longer, they might process slower, they might have dyslexia. They're not going to do well with these time tests. But that's what schools use, primarily because it's inexpensive, it's convenient, it's a short little screening tool. But I would hope that we could start to get more creative in the schools to start looking more broadly and not just focusing so much on these time tests, because I think we're having more and more individuals like this that just aren't quick readers.
Right. And the timed tests, what psychologically, that must, just hearing that, I mean, that stresses you out, right? You're not going to perform well.
Oh, absolutely. It's going to cause the anxiety that we talked about. And also it still doesn't get to the root of what dyslexia actually is, which is the phonetic problems. And what happens when the focus just is on getting people to read faster is we're still not addressing their difficulties with phonetic awareness. It's like trying to ram a square peg in a round hole. It doesn't matter how hard you try to push it in, it's not going to fit. And it's so important that we take the time to teach these children in the way that their brains need to be taught so that they can be successful and allow them to break the code of reading. And the way our schools typically teach reading is we don't focus on the phonetic awareness and phonics, even though the evidence points to the benefits of that. And so just reading faster doesn't actually address the underlying issue of dyslexia.
On Twitter, Chad writes this: let's not leave out all the things dyslexics do better. Process flow better, understanding of complex problems. So you talked about of many people who have dyslexia are highly intelligent. And so what do you make of that?
Yeah, so, I mean, one of the core components is there's generally this gap between where their intelligence or cognitive abilities are and where they're performing. And that's that true kind of factor of, oh, there's something going on, right? Mm-hmm. So something must be going on that's causing this gap of why they can't perform where we would expect them to be. But generally speaking, they do have areas of strength. So there's going to be certain areas that they might excel in, for example, around math or hands-on kinds of learning. They might do better with the math and science or the music and art, and really just struggle in that reading, decoding, which often also we haven't talked about, but usually is spelling also. Spelling also is usually very difficult.
Is a challenge. So those, and vocabulary and spelling and grammar tests, those are frequent things you get, in elementary school all the way through high school.
Absolutely.
All right. I want to bring in one of our listeners this morning in Eagan. Hannah is listening. Good morning, Hannah.
Good morning. Thanks for taking my call. I kind of missed some of the information just being on call, but this is a very sensitive and dear and heart topic for me. Mm-hmm. I have twin daughters, one that has severe dyslexia and the other not so much. And Groves Academy is something that we looked into in the past. It's a private sector. So my question is, what are some public resources that, and private, I guess, that would help support and identify a child that is suffering from this? Because what the school does, there's a long sigh when we talked about what does the school implement after the diagnosis has been established. And the school there's very limited resources. And so I'd like to also know what other communities or career paths that an individual with dyslexia would take. So 2 questions, public and private resources, and then what communities could I have my child involved in that help thrive her?
All right, that's Hannah in Eagan. Her one of her daughters, she has twins, severe dyslexia. So what is available that is not in a private school, or what do you see in the difference between private schools and public schools for students with dyslexia?
Yeah, this is a great question. I would recommend, if possible, trying to find some supplemental tutoring that might be helpful after school. She's right. In the schools are limited in terms of what they can provide and how much they can provide within the schools. But we've found that if The family has resources. So again, there's different places where you can pay for tutoring, and or I know that there's some communities that have tutoring or homework support help in churches, those kinds of other community centers. So it takes a little bit of navigating depending on where they live. In terms of like career path, there are lots of opportunities, and this is where I would try and highlight what are the strengths of the individual. I think an individual with dyslexia has lots of opportunities to explore, whether that be a strength in the arts, in the music, or even socially if they are very articulate. I have a family member who has dyslexia that is great at sales. So they are very successful in those kind of opportunities.
You play your strengths.
So, yep, you play in your strengths.
And in general, there are ample resources for people with dyslexia, but they cost money.
Correct.
They cost money. And so Groves Academy specializes in learning disabilities, but again, that's a private school.
It is a private school, but we really welcome anybody to have a conversation with us. They're welcome to call us. Every family is welcome to call Groves, and we would love to help guide them through all their options available. And it's really important that we take the time to have a conversation with them about what their needs are, and we can work together to find cost or scheduling things that work for them and help them connect families to other resources in the community, or if Groves is a good fit. We have a lot of different options. Like I said, we do have summer programming, tutoring, as well as the school.
So students who are not enrolled there, the staff, you all supply some type of help to the community. There's some community outreach. You don't have to be enrolled there to benefit from the expertise there?
Absolutely. And I would say the majority of our work is outreach, actually. With our learning center, where we see over 1,000 students, we also have an Institute of Professional Learning where we go out into the community and we help with literacy instruction in 30 schools, nearly 200 classrooms in K through 3. We also do have the school, but we also provide any parent can call and have a conversation with our staff at Groves, and we can really help them on their journey, whether it's with us or anybody. We
referrals.
Can help. Yep, absolutely.
Even. All right. In Rochester, Susie is listening, and Susie, we're talking about dyslexia. Go right ahead.
Hey, thanks for taking my call. Yeah, I'm dyslexic. I struggled as a kid, super energetic, not ADHD that I ever was told, but a lot of energy, really positive. As soon as I hit school, hit the third grade, I was held back because I could not figure stuff out. I just had a hard time processing, and from third grade on, I'm being held back in a small Spring Grove, Minnesota, small school. I hid out. I hid from everyone. High school teachers told me I was stupid. They wouldn't let me take science classes. I ended up in a drama class, actually, with the kids that I should have graduated with, so it forced me to connect with them again in a classroom of 48, Oh, they're going to call me stupid. And I just really felt bad about myself. Teacher told me once when I asked what 5/8 inch seam was, she said, if you didn't learn that in math, I'm not teaching you now. So there's a lot of, just never felt good about myself. I was diagnosed then after my first. I was told I overcompensated for everything but spelling. I got a Franklin speller, and I started with the help of my husband and just started feeling better about myself. But yeah, I worked in the education field now, a lot of different areas. Couldn't handle college with my dyslexia, but self-taught
Susie,
in so much.
Do you think an early diagnosis, if you had been diagnosed in elementary school, that would have changed your life?
It would have changed my life. I am an actor. It was in my first play. I didn't think I could actually musical. Couldn't handle it. And, it's just who I am is super animated. I just actually retired, and I do storytelling semi-professionally, and that's what I'm doing in my retirement. I can memorize anything if it's sequence-based. Mm-hmm. But, being able to memorize the play was really challenging for me. But I'm super animated. And working in the schools, worked in the high school for 18 years, and that forced me because I had to help teach kids things, and that helped me as a dyslexic person pick up and remember stuff.
All right. Well, Susie, thank you so much for sharing your story in such an honest, authentic way. What do you make of Susie there in Rochester?
I think it's that she's telling a very common story, unfortunately, particularly individuals that are older. I think I think we are getting better in the schools at hopefully catching and being able to diagnose. So hopefully this will start to change, I think, as the schools get better at this and it becomes a more common conversation.
But it sounds like, I mean, a lot of it really just comes from not knowing. Like, what are you dealing with a child?
Absolutely.
The child's not trying to be disrespectful and saying, I don't want to read, or trying to, get out of reading. That, if there's more awareness that this could be the issue, how that could change someone's path.
Absolutely. And I'm so sorry to hear that story, Susie. And unfortunately, it is a common one, especially like Mary Beth said, with older individuals, but also with children. I've seen multiple children who come in just feeling dumb, feeling like there's something wrong with them. And then also the parents, they blame themselves. Why can't my child read? What am I doing wrong as a parent? What have I done to cause this? And I think that information is so powerful. And once the diagnosis is given, you see this sense of relief, because it validates the child's experience. It validates the parent's experience. It helps them recognize that they did nothing wrong. Mm-hmm. Children who have dyslexia are not defective. They're different. Their brains are actually wired in a different way. And we need to focus on the strengths that dyslexic children have, rather than seeing it as a disadvantage or a defective problem.
So we know that there are interventions that help people overcome dyslexia. And so the significance of that early intervention, what do we know about early intervention and what it can do? I know that research has shown that about 70% of at-risk children who receive educational intervention in kindergarten or first grade become proficient readers. So there's evidence, if it's diagnosed early, that it can change someone's course in life.
Absolutely. That early diagnosis is so crucial. And the earlier we identify the diagnosis, the easier it is to remediate. And then the less likelihood that some of these other comorbid issues that we talked about with anxiety and depression are less likely to be there. That low self-confidence, the school refusal, some of those additional problems that develop with somebody going undiagnosed. And the earlier we are able to use the tools that we know will help them teach the phonetic awareness and the phonetic understanding, the earlier we do that, the better chances of success.
And Mary Beth, what are your thoughts about the earlier, the better, the outcomes? Absolutely.
I think in all areas of any disability category, anytime we can have that early intervention, the likelihood that that person is going to be successful is greater in helping them overcome some of these barriers and struggles. Something that happens over time, it's called kind of learned helplessness. So as children have experiences that are negative over time, they kind of learn this learned helplessness. So they stop even trying and they stop taking risks. So the more negative experiences they have, that it kind of reaffirms that. So if we can get in early intervention, I think it prevents that from happening, so that we can try and have more successful opportunities for these children to have success in school, so that they can still be readers, even though it might be difficult for them.
We're talking about dyslexia. We have lots of callers on hold who want to get in on the conversation. And we do want to take your calls, as well as talk more about accommodations. What does that mean in a school setting? And in the particular details on the interventions, what we know works to help people with dyslexia overcome it. Right now, we're talking about dyslexia. So much to learn about this. How is it diagnosed? What are the signs? What are the misconceptions? And what do we know about how students are able to overcome it? Adults as well. I have two guests joining me today. Dr. Elizabeth Schnobrich is a clinical psychologist who diagnoses children with learning disabilities at Groves Academy in St. Louis Park. And we also have Mary Beth Kelly here. She is a former special education teacher who now does assessments for children and adults through a nonprofit called the Learning Disabilities Association of Minnesota. I also want to hear from you. You can call in at 651-227-6000 or tweet me at Angela Davis MPR. Lots of folks want to talk about this in St. Cloud. Emma is listening this morning. Good morning, Emma.
Good morning. Thanks for taking my call.
Sure.
I myself have dyslexia, and I was diagnosed in the second grade, so like when I was 7. Mm-hmm. And so reading was a struggle, and I just wanted to say that I found audiobooks to be like a useful tool in just helping with like getting interested in reading again. Like,
Sure.
so if I had a book report, I could listen to the book and follow along with my copy at home. And I'm like 23 and out of college, and I still love to listen to audiobooks, and I found that can be a really useful tool.
That's wonderful advice for you to share about what works. And so your comprehension skills were great. You just had problems reading books, so listening to it helped you.
Right.
Excellent.
Yeah.
Thank you. That's Emma in St. Cloud. Does that sound familiar to you?
Mm-hmm.
Yeah.
Mm-hmm, absolutely.
Thankfully, we're in the digital age where I think we have access to more and more digital formats of information that people can then listen to, and I think that's helpful.
And while we're talking about that, what are the interventions that help? So what do you do? Like what do we know helps a high school student who has a lot of reading assignments, or a college student with dyslexia?
So there's kind of two areas of that. First, we want to look at how to help to overcome some of those dyslexia difficulties. And that what we found that really is necessary is explicit and systematic instruction in the knowledge of letters, awareness of speech sounds, and letter sound correspondence. So really helping them develop a better understanding of that phonetic awareness that we keep talking about. On the other side of that, what you're getting to with children and high school as well as young adults in college, those are what we call accommodations. And accommodations are ways that we can set up the academic environment for the child to be as successful as possible with the gifts that we've kind of mentioned with dyslexia. And there are multiple accommodations. The audiobooks is one of them. That's a fantastic one, giving them extra time to be able to complete homework and tests, giving them access to the lecture outline or notes so that they have something to follow along as they listen, and they have, rather than having to worry about writing the notes down is another example. I'm sure Mary Beth has a lot of fantastic examples of other accommodations.
What methods help?
Yeah, we definitely encourage the use of digital formats, not only just audiobooks, but most of the computers and programs now allow any digital format of information that you get. The computer then can generally read it. Yep, so reading, that's really helpful. Even on our smartphones, so even using speech to text. So your smartphone, if you're ever talking to it and have it send a message to somebody, you can do that with your computer as well. So that helps with some of the writing. Note-taking, there's lots of supports out there. I'm a fan of the Live Scribe pen, which is a pen that essentially records, but it has a flash drive that can upload it then to your computer. It's fairly affordable, so I think that's also helpful with some of the note-taking, because multitasking can be really difficult for individuals that struggle in these areas as well.
And then for a college student, they can record their lectures, like that note-taking part of it. You can record it.
Absolutely.
Absolutely. And one thing that people don't always realize is the accommodations that children can receive in high school, they can actually receive those accommodations in college and graduate school.
All the way through.
All the way through. And they can receive accommodations on ACT and SAT testing, GRE, LSAT. They can receive accommodations throughout their education so that they can really highlight their gifts and not be disadvantaged by some of their struggles.
And the process of getting accommodations, how does that work? And again, define, Mary Beth, what accommodations, what does it mean in schools?
Sure. An accommodation just is access to something that the individual needs, and it's generally because they have a medical diagnosis. So dyslexia, as we mentioned already, is technically a medical diagnosis. So the school would need to identify that, yes, this is in fact medical diagnosis, and it's a kind of a two-part question. The second question is, does this child then need accommodations in order to be successful in school?
And typically it's more time on a test.
It could be accommodations is broad, so it could be extra time, it could be a separate room to be able to take the information, it could be allowing them to listen to the test also on a computer so they're following along. There's all sorts of different types of accommodations.
Right. But there's a process, so you need a official diagnosis, and then you need to present, there's paperwork involved.
Correct. It's usually then made into what's called a 504 plan. So a 504 plan is a legal document. It's not as technical as a special education or an individual education plan, but a 504 plan still is a plan that's basically saying this child has a disability and they need these accommodations.
I saw a beautiful quote by a woman named Dr. Sally Shaywitz. She's the author of Overcoming Dyslexia, and she wrote, "Dyslexia robs a person of time. Accommodations return it."
Absolutely. One thing I wanted to add to that discussion of accommodations is it's really important to have, like I mentioned, a very comprehensive evaluation because of those other potential issues that could be going on. And we mentioned the term comorbidity, which means that there are other diagnoses going on at the same time. And it's incredibly common with dyslexia to have other things going on. And so when we have accommodations, we don't want to have general accommodations. We really want to have accommodations for that specific child and their unique needs, because every child with dyslexia is unique and special. And we want to make sure that we create the plan that works best for them. And that's one of the things we do at Groves is when we write our reports, we have very specific recommendations that we provide for them to take to the school to help with that 504 plan or the IEP.
I want to go back to the phone lines. In Long Lake, Claire is holding on. Good morning, Claire.
Hi, good morning.
Hi.
Thank you for answering my call.
Absolutely.
I just wanted to share my story that I was diagnosed in second grade, and I went to Groves for 3 years, and I feel like Groves helped me a lot. And that now I go to Orono Middle School.
And what grade are you there? What grade are you in, Claire? At
seventh grade.
Okay.
And now I feel like I can do so much more because of Groves, and they've helped me so much.
So, Claire, can you describe what you were having problems with when you were reading?
When I was reading, it was just it was hard for me. I couldn't really see the words very well. It was kind of blurry. Mm-hmm. And sometimes and Groves helped me, and they taught me to make flashcards. So, like, if a word that I was struggling with, I would maybe draw a picture too, just to remember it better.
And did you find that, did you try to hide that you were having problems reading in the beginning, or did it become easier to let your teachers know you were having problems?
Well, I didn't really know until, like, my parents let me know. I didn't know what I had. I was kind of confused on what I had. Mm-hmm. And I don't know. And
now, so you feel good about yourself and that you're doing well now in school. And what do you want people to know about having dyslexia?
Having dyslexia is really not that bad if people help you. Mm-hmm. And I also went to Dyslexia Day at the Capitol, mm-hmm. and to help public schools, to help with public schools getting resources for people with dyslexia like me.
All right. Well, Claire, thank you so much. And she's in middle school, 12 years old. Thank you for calling in and sharing your story with us. And so that is very inspirational to know that you can make progress. But first is that intervention and being able to share with people that, I could use some help with this. Yeah.
Yeah, it's nice to hear her advocating for herself. That's what we always hope for individuals as they learn more about their disability.
And finding out what works for her, too. In St. Paul, Susan is holding on. Good morning, Susan.
Good morning. Thank you for this program. I'm an occupational therapist that works in the public schools, and I really appreciate the expertise of your experts on the line. Mm-hmm. And I just wanted to comment on, you were talking about the comorbidity factor, and I totally agree. And it is hard to tease out because often when a child might present with symptoms of ADHD or depression, a lot of times it comes down to them not being able to follow along because of the dyslexia and looking like they're not attending because they can't attend because they can't follow along, or depressed like some of your listeners have commented on because they can't keep up and feel down about their skills because of that. And also the accommodations part, that's a lot of what I do with the students on my caseload is making sure that they have those accommodations and that they're being used correctly.
And Susan, how does that work out with the accommodations? Are the students comfortable with having that? Or because I know with some kids they feel like, I feel like I'm getting an unfair advantage, and they don't want it. They don't want to be treated differently.
Oh my gosh, that's totally the case. Yes, there is a lot of that to work through, and there's a lot of that to work through with teachers as well. But kids don't want to look different, and when you're setting them up with assistive technology, yes, that is something to overcome. And what one of your experts was, I don't know if it was Mary Beth, was mentioning about the voice to text. That has just been such a godsend to some of these students where they can actually keep up. It's not that they don't have the right ideas and they understand the topic. It's just getting those thoughts down on paper so they talk right into their Chromebook and it comes up on their Google Doc, and it's really helpful.
That's awesome. Susan in St. Paul, an occupational therapist, working with students. So technology, that's wonderful to know. So can you just speak to that? Like, again, like what is available to help overcome dyslexia?
Yeah, honestly, it can get overwhelming just because there's so many options out there as it relates to technology. Again, I think for some children, they might even be more tech savvy. I think this is why a lot of it goes undiagnosed, because children can figure out, oh, this is actually helping me, and so they kind of incorporate some of their own technology sometimes as an accommodation, and they end up kind of hiding behind some of that and can be successful in the classroom as they're using some of these tools and they explore it. So I definitely think technology is a plus at this point, and can be very helpful. I get worried about schools that limit technology, because even smartphones allowing students, I know the controversy, so I'm not trying to say that it's definitely can be difficult, but allowing children to even take phone pictures of with their smartphone of the notes
board.
Of the board, that could be really helpful to be able to go back and refer to. So I don't think that it's always evil to have the smartphones or cell phones along.
Right. It could be hard to manage in class. In St. Paul, I want to bring in Damien, who is listening. Good morning.
Yes, good morning. Thanks for taking my call. I just wanted to talk about something that I talk to many educators, and they have never heard about, the cousin of dyslexia, which is dysgraphia. And I was diagnosed in my early 40s, and I struggled through my whole life, not being able to spell, not being able to put together correct sentence structures and things of that sort. And I always thought it was me. It was my problem, that I went to good schools, but somehow I didn't catch on. And once I was diagnosed, it was like a weight was just lifted off my shoulders. And, I knew that there was a reason why this was happening. And so it made a difference in my life.
How old were you when you were diagnosed with dysgraphia?
I was in my early 40s.
In your 40s, wow. All right, that's Damien. I've never heard of dysgraphia. Like, again, what is that? He describes it as a spelling or a writing disorder.
So it's I liked how he described it. It is related to dyslexia, and when you have dyslexia, we mentioned the difficulties with spelling. That is one part. Dysgraphia is more of the written language side of it. So difficulty with writing long pieces, long text. Difficulty organizing your written language, being able to put sentence structure in the appropriate order, being able to put paragraphs with a beginning, a middle, and an end. And as you can imagine, that's going to be a big struggle in school, because the older you get in school, the more that is a requirement.
And in the workplace.
Absolutely.
Writing reports and...
Yeah, honestly, I think lots of these individuals, he was very articulate. So my guess is that a strength often is they're very verbal. So again, I think that's one of the reasons they can go undiagnosed. So unless you're really looking at the individual's writing, you're not able to see that.
But in some cases, I think because people are very verbal and can present, then the expectation is they've got to be phenomenal writers.
Absolutely.
And then when that turns out not to be the case, then they can run into problems. In Roseville, I want to take a call from Sarah, who is listening. Hi, Sarah.
Hi there. I wanted to tell you, I get choked up when I think about all the trouble my son had growing up. But anyway, he was diagnosed about in the 5th or 6th grade, and he just soldiered on in middle school with a lot of behavior problems, got into high school with a behavioral disorder in addition to everything else. He did really, really well in the really hard classes and did less well in any class, of course, that required reading or writing. But he went to college. He flunked out after the first year because he just was not getting whatever they were telling him. I don't know what he did during his off year. He was locked in his bedroom as far as I could tell. But anyway, he went back to college, and he had realized at that point that he had to go to class every single day. He had to see and hear the instructor. He had to see what they had written on the board or the slideshow or whatever. In any case, 6 years after high school, he finally graduated from college as a mechanical engineer, and he is now very successful.
Oh, did he ever get a diagnosis of dyslexia?
He did. He had a 504 plan. He had an IEP, and the high school stonewalled us all the way through. Well, we can't afford to get all this technology. Now, remember, this was in the early 2000s, so there wasn't as much technology available. But anyway, they said, we can't afford to buy him a laptop computer. I said, we'll buy the computer. We bought the computer. But we can't afford the software. We'll buy the software. And even with us paying for all of this, we got stonewalled in the worst possible way.
Sarah in Roseville, I'm so happy to hear your son is doing well now as an engineer. Thank you for sharing his story. So he figured out, like, again, being present, he needed to hear the lectures, and that was a turning point for him and being able to soldier on.
Yeah, absolutely. We do assessments on college students a lot, and one of the recommendations I often tell them is get to class every day. So your instructors see your face and they get to know you, because I think that makes a world of difference, and it also communicates to the teacher that you're trying, and I think that can make a huge difference.
And I wanted to add, too, that story is pretty common with boys. Boys tend to be twice as likely to be diagnosed with dyslexia because of those acting out behaviors. They tend to get referred for evaluations, not necessarily for dyslexia, but for behavioral problems, ADHD. And we end up discovering that they actually have dyslexia, and that's been part of the driving force. And girls are just as likely to have dyslexia, but they're more likely to hide it and get misdiagnosed.
Wow. That's something that there's a gender difference. That's it. And I should mention before I forget this, there are a lot of famous people who now publicly talk about having dyslexia. The movie maker Steven Spielberg, actor Tom Cruise, businessman Richard Branson. What's the value of having, that public conversation, or people who are considered celebrities or very successful saying, hey, I have this and I still, lived out my dream?
Well, I think it definitely can provide some encouragement for children that are struggling to see, there is hope that even though I have this, I can still be successful after school, and there are opportunities for me to have a career, despite the fact that I might struggle in these areas.
You keep getting us to that point. You keep saying you can still have that career, whatever you want to do.
I also think it helps to reduce the stigma. And we talked about earlier how historically we've thought of kids with dyslexia as unintelligent or slow learners or lazy. And these are very successful people. And that's just the tip of the iceberg of the list. There's many, many people who are incredibly successful in engineering and art and entrepreneurship. And they have these amazing gifts. And I think that's a really important message to kind of take home, is that kids with dyslexia, it's not a disability. They are not defective. They have, they learn in a different way, and they need to be taught in the way that they need to learn.
All right. I want to take another one of our listeners who's on hold in Minneapolis. Emily is holding on. And Emily, you have a question.
Yeah. Hi. I'm calling because my partner has he struggles with reading, and he talks about going back to school. He's 38, and I was wondering, for somebody who is that late in life and hasn't been formally diagnosed with a learning disability like dyslexia, what are the resources to get that ball rolling so that when he does go to school, he can get those accommodations that can help him get through and, learn what works for him, even though he's not a middle schooler or even just out of high school. He's, definitely later in life.
Thank you.
On that journey.
Thank you. That's Emily asking about what resources are available for adults. And just to add on to that, on Twitter, Loki writes, we're listening to the dyslexia discussion on MPR right now, and my grandma is discovering she probably has dyslexia. So for adults, folks who think, as this was me, this is me, what's out there that can help them, move forward or overcome what they're dealing with?
I think especially in the case of the caller where he's thinking about going back to school, I think a full assessment is probably the best starting point to really get the information necessary. And
where do you go, though?
They're welcome to contact Groves. We can certainly talk through our resources that we have available, as well as help them figure out if there are other resources in the community that might fit, depending on where they're located. We have people of all ages come to Groves from all parts of the region. We have people coming from Fargo,
But it's a medical diagnosis, so couldn't I start with my primary care physician and then go from there?
You certainly could. You could try and go through insurance. So LDA also does assessments, but we generally encourage families to try and go through their insurance first to see if they cover it. Often insurance does not cover this type of testing, but it's worth the conversation to at least ask. Otherwise, there are places where it's a fee-based. We, do payment plans with lots of our families because it can be very costly. Another possibility of a resource is adult basic ed can often sometimes be helpful with supplementary kinds of supports around tutoring, that kind of stuff, not doing an assessment, but at least being helpful in terms of tutoring options.
And you said LDA, so that's Learning Disabilities Association of Minnesota. They're
correct.
In Golden Valley. So you can refer people to resources. But again, the starting point is like someone who's trained needs to make the diagnosis for you before you can proceed with getting help officially.
Right.
In Duluth, I want to take this call from Kimberly. Good morning, Kimberly.
Good morning, and thank you. I was hoping that your guest could address the issue of colleges asking students to be retested. All my children have dyslexia, and my most recent graduate was told that she needed to be retested before she could get accommodations. And she underwent, so she's 18 now, and she underwent very comprehensive testing at the age of 14. And so I, would like to hear what your guests have to say about the need for that.
In Duluth, that's Kimberly. So I guess for students, is there an expiration on your diagnosis? You have to be retested?
Yeah, it's typically every 3 years is what we, and that's for school age as well as going into college.
Actually, some of the colleges will accept 5 to 7 years. It just depends. The biggest key factor is that they have an adult IQ. So that's one of the issues is that the adult IQ starts at age 16. So they generally want an adult IQ so they can look at those adult kind of scores to see how is this child or how is this individual going to perform at the college level.
And before we go, I want to make sure we get one more call in. This is Stephen in St. Paul. Good morning, Stephen.
Yeah, hi. I was calling in. I have a 6-year-old daughter that's been diagnosed with dyslexia. Now, she's been, last 6 years of her life, she's been moving between here, Minnesota, and Mississippi. Now, I know earlier you guys talked about phonetics. Now, I was wondering if maybe the difference in dialect between here and Mississippi, because she has gone to school here and there, does that play a role at all in her dyslexia? Can that play a role at all in her dyslexia?
Okay, and Steve, in case people had a hard time hearing you, his question, he has a daughter who lives in Minnesota and Mississippi, goes back and forth, and he's wondering, could dialect play a role in her issues with dyslexia? Dialect. Mississippi, Minnesota sound very different speech patterns that you would hear.
Yeah, absolutely. Dialect is definitely a factor. And again, I would hope whoever does the assessment would take that into consideration so they could even help the family figure out the different types of sounds that the child should be working towards.
And I would add another potential component to that is the instruction. We really want to see, is there a difference in how the child is being taught to read in the school in Mississippi versus the school in Minnesota, because that also can play a role in them learning to read. And that, if it's instruction-based, that's not dyslexia.
Well, I have learned so much about dyslexia this hour, and we are unfortunately out of time, but thank you so much for answering so many questions for us today. Dr. Elizabeth Schnobrich, a clinical psychologist at Groves Academy in St. Louis Park, which is a learning center for children with disabilities, learning disabilities, and Mary Beth Kelly, a former special education teacher who now does assessments at Learning Disabilities Association of Minnesota. Thank you, ladies.
Thank you for having us.